Bismillah Rahman Rahim. Welcome to all of you to this video tutorial in which I will discuss the thrombocytopenia. As you all must be aware about the term that the thrombo is used for the platelet and penia mean deficiency of the platelet. As you all know about the normal coagulation process, that what happened during the normal coagulation process. Suppose if the cut occur within these blood vessels, so the localized platelet that is present within this blood circulation will come and adhere to the non-platelet surface to the endothelial lining of the blood vessels, that is called the platelet adhesion, and then further the platelet will adhere to one another, that is called the platelet aggregation process. So one was the platelet adhesion, in which the platelet is attached to the non-platelet surface, and then the platelets attached to one another, that will be called as the platelet adhesion. And then the when the factor 1 inactive factor 1 fibrinogen is converted to the factor 1 activated factor 1 fibrin, and then a mesh-like network is formed in this at the site of this cut, so the bleeding process will stop. And so this is now the normal process of the coagulation. If we go toward the definition of the coagulation, so we can define the coagulation as the process, the conversion, the process in which the soluble fibrinogen is converted into insoluble fibrin is called the coagulation process, जिसमें जो है platelets एडमेन रोल प्ले करता है, जिस तरह मैंने पहले बताया कि platelet जो है मोस्टली platelet adhesion and platelet aggregation, और फिर जो factor 1 है fibrinogen वो activate होता है that is to the fibrin, and then a mesh-like network is formed and the bleeding is stopped. So the platelet play a major role in the normal coagulation process or the coagulation cascades. So this is the term thrombocytopenia that is used, in which due to some either due to some reasons the production of the platelet is decreased, or either the destruction of the platelet is increased, or due to its treatment within the spleen, there is the reduction in the numbers or the counts of the platelet from the normals, and then the coagulation process is disturbed, and there is a bleeding tendency within the skin that is also called the petechiae or the ecchymosis, or even the nose bleeds, that is called the epistaxis, or even from the gums or mouth there is a chances of the bleedings. So now let's proceed toward the thrombophosis process, that is the production of the platelets. So if we go attention toward this, so जब नॉर्मल थ्रोम्बोफोसिस प्रोसेस होती है, जैसा कि जिसमें जो है प्लेटलेट प्रिपेयर होते हैं, सो फर्स्ट ऑफ ऑल जो माइलॉइड प्रोजेनर सेल है, जैसे कि आप सबको पता होगा कि नॉर्मल हेमेटोपोइसिस प्रोसेस में क्या होता है, एक पोलीप्रोटीन स्टेम सेल होता है, फिर जो है वो डिफरेंशिएट होता है आइदर टू दी लिम्फॉइड सेल और टू दी माइलॉइड लाइनेज. लिम्फॉइड लाइनेज में जो है मेनली यहाँ पर बी सेल एंड टी सेल्स प्रिपेयर होते हैं, एंड आल्सो दी cytotoxic T cell or natural killer cell, while in the myeloid lineage यहाँ पर जो है different granulocytes like the basophil, eosinophil and neutrophils are prepared. Also the mast cell that play a major roles in the anaphylaxis or the allergy, and also the monocytes are the macrophages, and also the other dendritic cells, that is the antigen presenting cells, APCs. So these are the normal hematophosis process. So इस hematophosis process के दौरान जो है इसमें जो है platelets भी फॉर्म होते हैं अकॉर्डिंग इन दी माइलॉइड लाइनेज. इसका जो है बैकग्राउंड कुछ यूँ है थ्रोम्बोपोइसिस का, कि फर्स्ट ऑफ ऑल जो माइलॉइड प्रोजेनिसर सेल है, then they break toward the pro-megakaryocytes, and then they is converted to the megakaryocyte, and then from the megakaryocytes in the cytokine storm scans, so that megakaryocytes and then differentiated to the a large number of the platelets. So this is the normal thrombopoiesis process, जिसके through जो है different a large number of the platelets are formed, and then platelets then play a major role in the normal coagulation cascade or the normal coagulation process. So what happened during the thrombocytopenia? This is a condition जिसमें जो है प्लेटलेट की जो काउंट्स है और नंबर्स है वो 150 से और 150 or to 1,50,000 to 4,50,000. This is the normal range of the platelets. So उससे जो जब platelet की amount decrease होती है, so then that is called the thrombocytopenia, and then there is the chances of the bleeding. So that will be called as the bleeding disorder. So now let's proceed toward the outline of this chapter. So as I have first of all discussed the introduction of the thrombopoiesis or the normal hematopoiesis process, कि किस जिसके बेस पर जो है different blood cells that are prepared, and then the background studies of the thrombopoiesis, and then I will discuss the causes of the thrombocytopenias. Three main causes, like the either the destruction of the platelet is increased or the production of platelet becomes slowed down, and also when the platelet trapped in the spleen due to a lot of reasons. And then the sign and symptom of the thrombocytopenia, and then how we will diagnose the thrombocytopenia, and at last but not the least, the treatment of the thrombocytopenia. So if we introduce or define the thrombocytopenia, so a condition in which the blood has lower than normal number of the platelet, that is called the thrombocytopenia, and the normal range of the platelet is 1,50,000 to 4,50,000 per microliter. So this is the normal range of the platelets, 1,50,000 to 4,50,000 per microliter. This is the normal range of the platelet. When the platelet count is decreased from this, so that will become the thrombocytopenia. Then there are a lot of conditions that may be either the mild, moderate, or severe thrombocytopenias. So here it is mentioned that the mild to severe bleeding occur. Risk for the severe serious bleeding happen when the number of the platelet decrease from 10,000 to 20,000 per microliters, and then there is a huge chances of the severe bleeding, and it can be fatal, even it can lead to the death. So this is the introduction of the thrombocytopenia, that when the platelet count is decreased from this normal range, so that will be called as the thrombocytopenia, and it can within either the mild case, moderate case, or the severe thrombocytopenia. Now, what are the different causes of the thrombocytopenia? So three main causes, like the trapping of platelet in the spleen. This is one of the reason के a lot of factors की वजह से जो platelets है, they trap within the spleens, and then उसके बाद जो है spleen में गैदी भी हो जाती है, और platelet की जो amount है circulation में वो कम हो जाती है, और जो coagulation process है, they are disturbed. The second reason is the decreased production of the platelets, and then the third reason is the increased destruction of the platelet due to some autoimmune diseases or due to some medicines. The platelet is destroyed, and due to that, the circulation of the platelet and the bloodstream is decreased. So these are the different three main reasons of the thrombocytopenias. Now I will discuss individually each and every one in a slight detail. So the first one was the platelet trapped within the spleen. So one third of the body platelets are present normally in the spleens. The normal process के through जो है a lot of the जो platelets है, one third of the platelets they are present in the spleen. Spleen जो कि एक also play a major role in the immune system as well. So one third of the platelet they are present normally in the spleen. Suppose this is the spleen, and about one third of the platelet are present in it. But due to some cancers or some liver diseases, as the liver produces a large number of the clotting factors, and that then play in the role in the normal coagulation process. So either due to cancer or some liver diseases, or due to myelofibrosis, there is also a condition. The spleen enlarged, and it trap a large number of the platelets. So it decreases the platelet count and the blood circulation. So this is one of the reason of the thrombocytopenia, कि जो platelets की amounts है वो blood circulation में कम हो जाए due to cancers or the liver disease or myelofibrosis. all of the platelets are trapped inside the spleen, and they didn't come out toward the blood circulations. So फिर वो जो है thrombocytopenia and that happened, and there is a chances of the bleeding. The other reason of the thrombocytopenia is the decreased production of the platelet now due to a lot of the cancers like the leukemia. This is the blood cancers, and due to some lymphomas. This is also the blood cancer, but this is mainly in the lymph region, lymph nodes and localized to the lymph. And while the leukemia is also white blood cells cancer, but they can spread to other area of the body very quickly. And there are further subtypes of the leukemia and lymphomas as well, like the lymphoma, Hodgkin lymphomas and non-Hodgkin lymphomas. Is there leukemia, different types, say like myeloid leukemia and lymphoblastic leukemia, etc. So due to these cancer, the production of the platelet is decreased due to the aplastic anemia, जिसमें जो है red bone marrow, they are replaced by the yellow bone marrow, and that bone marrow then didn't perform properly the hematopoiesis or thrombopoiesis process. So due to aplastic anemia, there is also a risk of the platelet destruction, and that may lead to the thrombocytopenia, and also due to some toxic chemicals like the pesticides or arsenics or even benzenes, and also due to some medication like the diuretics, NSAIDs and chloramphenicals, and even due to alcohols or some virus infestation like the chickenpox, mumps, rubella, and EBV, Epstein-Barr virus, or the hepatitis C or HIV. They can also contribute toward the destruction of the platelet, and also some genetic condition are the inherited thrombocytopenia, that is the Westcott, Aldrich, and Mehegan syndrome. ये जो है ये both these both are the genetic condition जिसमें जो है genetically platelet की amount जो है they are below the normal range, that is from 150 to the 450,000, और अगर ये amount 10 to 20,000 per microliter से decrease हो जाए, so then there is a severe tendency of the bleeding. So these were the second most common cause of the thrombocytopenia. Now the third one is the due to some increased destruction of the platelet. That may be either due to autoimmune diseases like the immune thrombocytopenia or the SLE, that is the systemic lupus erythematosus, or due to the rheumatoid arthritis, or even due to some drugs like the quinine, that is antimalarial, and some sulfonamides, even the phenotime anticonvulsant, the antibiotic vancomycins, or even the rifampicin, there is the first line anti-TB drugs, and the heparin induced. This is the most common cause, by the way, drug induced thrombocytopenia, that is the heparin induced thrombocytopenia के हेपरिन की वजह से जो है ब्लीडिंग टेंडेंसी होती है, और फिर जो प्लेटलेट की अमाउंट है वो कम हो जाती है. And then due to some rare condition like the thrombotic thrombocytopenic purpura, and due to some hemolytic uremic syndromes or DICs, that is the disseminated intravascular coagulopathy, जिसमें जो है नॉर्मल जो ब्लड सर्कुलेशन है इसमें जो है abnormal clots, small clots, they are formed, and due to this small clots the amount of the platelet is decreased, and this may cause the thrombocytopenia, and due to some infections or even pregnancy. So these are the contributing factor toward the thrombocytopenia. So now let's proceed toward the some clinical manifestation on the sign and symptom of the thrombocytopenia. So this may be petechiae, mean bleeding within the skins, and on the basis of their length or thickness, we can classify that to either the petechiae or ecchymosis, or even the simple bruising. So this may be the petechiae, or even the easy or excessive bruisings, mean bleeding within the skin, and then the prolonged bleeding from the cuts. If some cuts occur, small cuts through the knives or even spatulas, so after the in the normal individual, that cut will heal very soon, and the normal coagulation process will happen. But in the thrombocytopenic patients, there is a bleeding tendency, and then the symptom is the gingival bleeding, And this is the suppose the gingiva are the fascians, so there is a chance that a lot of bleeding will occur from the gums on these fascians. By the way, this is also due to the vitamin C deficiency. This is that is also called the scurvy. And then there is the nose bleed. There is the epistaxis. This is the lady from which is suffering from the thrombocytopenia, and there is severe bleeding from the nose. There is the epistaxis, and then the hematuria, even blood in the urine and blood in the stools, or even the heavy menstrual bleed. That is the dysmenorrhea, or even some other condition जिसमें जो है abnormal bleeding होती है menstrual cycle में. And then the fatigues, and then the enlarged spleen, of course. So the splenomegaly will occur because a lot of the platelet will trapped inside the spleen, and that contribute toward the thrombocytopenia. So these all are the different clinical manifestation of the thrombocytopenia. Now, how we will diagnose the thrombocytopenia? So we can do a lot of tests like the complete medical histories, even the physical exams, or some diagnostic tests, blood tests like the CBC, complete blood count, or the blood smears, peripheral blood smear especially, and the bone marrow test, or the aspiration biopsy from the bone marrow, or other tests we can also perform like the FAT, that is the prothrombin, and the PTTT, that is also called the APTT, that is the activated partial thromboplastin time. Now let's proceed toward the treatment of the thrombocytopenia, that how we will manage the patients of the thrombocytopenia जिसकी जो platelets count है if they fall from the 50,000 per microliter, so they may cause the bleeding tendency. So how we will manage that patients? So the first one is depend on its cause and severity. जिस तरह मैंने पहले बताया कि a lot of the cause है thrombocytopenia की, one of them was the प्लेटलेट जो है वो ट्रैप होते हैं स्प्लीन में, इसके lot of reasons थे कि either या तो कैंसर की वजह से, या liver disease है, या even myelofibrosis की वजह से. The second was the destruction of the platelets, so the decreased production of the platelet, इसमें जो है a lot of cancer and drugs involved थे. And also the increased destruction of the platelet and some autoimmune diseases like the SLE, systemic liver erythematosus, or even some genetic thrombocytopenia. Because of all these reasons, the thrombocytopenia happen. So the treatment depends on the cause and the severity of the condition. Treat the underlying cause first of all. If there is mild thrombocytopenia, so it didn't require the proper treatment, while if the condition is quite severe, so in that case we can do the blood or the platelet transfusion. The first choice is this one, and the second would be using some medication, especially the autoimmune, the steroids. And then in the last, if the condition is quite severe, so we can do the splenectomy. We can even remove the spleen. So these are the different approaches to treat the thrombocytopenia. So which medication we can use? If the condition is due to some autoimmune diseases like the SLE, so we can use the different corticosteroids, that is the prednisolone, prednisone, and prednisolone, and also the dexamethasone. By the way, dexamethasone is the most commonly used steroid. And then also some other immunosuppressing agents like the calcineurin inhibitors, or even the mammalian target apomycin inhibitor and TAR inhibitor, and also some other anti-proliferative or cytotoxic agent like the cyclophosphamide, etc. In patients with chronic immune thrombocytopenic purpura (ITP), there is the idiopathic thrombocytopenic purpura. Idiopathic means its cause is unknown. Who have had insufficient response to steroid, immunoglobulin, or splenectomy. We prefer these both techniques. अगर means a condition है जिसमें जो है idiopathic thrombocytopenic purpura है, so for that condition and the steroid didn't work well, so हम या तो splenectomy करते हैं, means spleen को remove करते हैं, या different जो immunoglobulins हैं, antibodies हैं, we administer that to the patients. And other approach is the using of the rumiflostin. That is the actually the factors that stimulate the erythropoietin. No, sorry, the thrombopoietin that is secreted by the kidney or the livers, and then that thrombopoietin play roles in the hematopoiesis process or the platelet production, or we can also use the L-trom L-thrombophague. We also use this substance that is actually the thrombopoietin receptor agonist, meaning it's bind to the thrombopoietin receptor and stimulate that, and due to that, the normal thrombopoiesis process will happen. So this was all about the thrombocytopenia and thrombocytopenia, and this means platelet the amount a specific range 1,50,000 2,50,000 is the normal range. अगर condition जो है platelet per microliter 50,000 से decrease हो जाए, so that will rise the bleeding tendency. फिर इसके जो है causes हमने discuss किए, different causes थे, three main causes. Then the what will be the sign and symptom, and then the diagnosis of the thrombocytopenia, and last we discuss the treatment of thrombocytopenia. So thank you all and stay blessed.